As the year 2023 winds up, there are some factors that shape the year, one of which is the highs and lows recorded by the pharmaceutical sector in the country. This year, Nigerians cried out over the rise in the cost of drugs and other consumables following the exit of some renowned pharmaceutical companies in the country. The exit of these pharmaceutical companies had been projected to reduce people's access to safe and potent medication, inflate and the cost of drugs and other pharmaceuticals, and promote the influx of fake drugs into the market and scare off other investors operating in the same sector. Now, another setback is the brain drain in the sector, where professional pharmacists left in droves in search of greener pastures. Well, joining us in the studio to discuss more is medical consultant, Chief Medical Director, Heritage Men's Clinic, Dr. Rashid Abbasi. Good morning.
Good morning.
Good morning. Thank you for joining us. Compliments of the season.
Same to you.
Now, when you look at the health sector, narrowing it down to the pharmaceutical, now, I wonder what your assessment of 2023 is. I know we have highlighted some of the issues, but let's get your perception.
If we're to grade, you know, A being what we all hope for, it's probably going to be a C. And this particular one we're talking about with the flight of pharmaceuticals is something that really affects us at our core. So we discussed a few weeks ago about brain drain, brain gain, and everything. When you're talking about pharmaceuticals, it's actually the only thing that has either a positive or negative effect on your lifespan.
Right.
If we don't have access to good medications, the likes of UK, US, Canada, their lifespan increases gradually because they've discovered these new medications, research and development money, and so they continue to get better. In Nigeria, we don't have any of those. If you look at the 10 highest grossing pharmaceuticals in the world, none of them exist in Nigeria. And so the last couple of weeks, we now had the likes of Procter & Gamble, we have the likes of GSK leaving. Not only did they leave, they left without manufacturing base anymore in Nigeria. So we're going to just become another consumer nation. They're going to produce it elsewhere, where they can now hire the locals elsewhere. It could be a neighbor, it could be Ghana, it could be Cameroon, it could be South Africa. And then they're going to bring the products back to us. But the main thing for us medically is that when these people leave, they create a vacuum. We really don't have an institution where we can actually checkmate what the vacuum will lead to. That's the production of adulterated drugs. And you mentioned earlier in the intro where Nigerians are facing one of the highest costs of medications now.
Yes.
But then when the adulterated medication comes in, we even pay more. Because we don't have a system to check, and people are taking the wrong medication, so our lifespan continues to be cut short. We're talking about brain drain. We don't even have a chance to look at them, saving our most valuable human resources. So pharmaceuticals is actually key. It affects microeconomics and macroeconomics. So we really need to throw out the red carpet to try to bring them back.
So in bringing them back, well, one of the reasons why GSK is leaving is because it said that they lay claim to, they blame the subsidy, fuel subsidy removal. They also blame foreign exchange. Even while they were here, they're still importing the raw material. Even there is one manufacturing company here, Foodie or something, the one at Songwater, that they still import about 90% of their raw materials. So what do you think government can do in this regard? Is it to remove import duty, or what role can they play in ensuring that the price of drug, the cost of getting drugs is not, bank breaking?
Absolutely. So let's look at what the government has done that has worked successfully in terms of tax break incentives. They gave it to our religious organization. So every corner you and I see in Lagos, there's either a church or a mosque. The reason for that is a tax break. Let's do the same thing if healthcare is actually a prime thing to us. The US government does it all the time. When they were looking for medications to bring to West Africa for HIV, they incentivized Pfizer. That's what happened to PEPFAR. That was $16 billion from US government. They had to give incentives to these manufacturing companies. Let's do the same thing. Because we already know that if you're not a manufacturing base, it's difficult for you to catch up on dollars. And then we can look at all other areas. Nigeria spent excess of $2 billion on medical tourism. What they're going out for medical care is specialized care.
Yes.
So the only way to bring or to reduce this is let's try to do some of this locally. It's a supply chain thing. We may have some of the raw materials, but when our smartest are living to where talent is being appreciated, we're going to continue to lose. But when you look at where we're losing lives, fake medications, not having any medications at all, this is actually the time for the government to step out, incentivize them. It could be tax breaks. It could be, okay, because these foreign companies are paying two taxes. They pay in their home country, and we're asking them to pay here. So if we actually incentivize them, we could give them, we're not saying tax break forever, 10 years, 15 years, and if you hire a lot of Nigerians, 40% of your employees are Nigerians, you get more tax break. Because on the other side of it, we are going to get the money back. Nigerians are hired. Some of these Nigerians, when they get the experience, they can go into compound pharmacy. Compound pharmacy are local things, and then we have access to the formula. We don't have to spend the money for the research and development because it's copy and paste. A lot of countries are doing it.
Well, the president recently was appealing to these people that they shouldn't go and talking about how we are here together, something like that. And I'm wondering how far that would go in making them return. Perhaps this matter of tax break might be an option for them to say, okay, if we put this forward before the government, we'll have them back. But let's look at traditional medication now, because we see a lot of persons turning their attention towards the use of herbs and all of that as to bridge the gaps that we're seeing. How perhaps can we improve on that? Because that has always been a major concern. Right.
No. That's a good point. And nobody is advocating that we should kill that sector. Because you know what? These foreign countries are actually, they're embracing it. Because we know that all these medications you and I take, either paracetamol, Tylenol, ibuprofen, they synthesize them from local herbs. However, at this point, we're talking about acute critical situation. I mean, the likes of amoxicillin, this is one of the oldest medications. The price has gone up over 1,000%.
Yes.
So we need to save lives now, and then we can strengthen all these local producers. Part of these local producers, they actually need to be refined. They need the technology that these big manufacturing companies will bring to the table. And when they come like that, they're going to bring some of our diaspora back. The diaspora can now, allays with all these local manufacturers. Nobody is saying that we should close down on the local herbs. The problem with the local herbs is nobody knows the dosage, the way they're being put together, the side effect mounts up. And we don't have any healthcare situation to deal with.
There are those who specialize in that, who are seemingly have studied some of this. Some of them are scattered here and there in the country. Perhaps we need to begin to identify them and have some level of collaboration with them.
Absolutely. That's what we need. National Institute of Health, one of the biggest in the whole country in the US, has a big department for natural herbs, alternate medicine. We can do the same thing. We are endowed with all these natural
Do we
resources.
not have something very close to that? Because I know that I've got some drugs from Forestry Research Institute of Nigeria, where I think I told you about the drugs where you get malaria vaccine, and then that can protect you against malaria for like 3 years. I used it, and I'm actually saying it worked for me. So, and also introduced to some people which worked for them. So why don't we have, because I asked the person, okay, fine, this is a research you did. The person actually did the research in the US. That's his own PhD research. So why is this thing not, why does it not proliferate the market? Why is it that the government does not work? And he said, you want all the big pharmaceuticals, they're going to kill you down. So why do we have that in this country?
So everything is, follow the money and you see where the evil lies. It's all about money. The big pharmaceuticals, even in the US, they will tell you that, look, we spend money on the research and development. So we need some time to regain our money back. And that's the fight about generic. So this particular case is a medication that has worked. The government can use their leverage. Even when you throw out the carpet to all these people, there are conditions to what you're offering them. The tax break, this and all that break, there are conditions because the government eventually has the final leverage. And so you say, look, while you're here, while you are in Nigeria, even though you are hiring 40% of Nigerians, we want you to put some research and development money into non-competitive areas of pharmaceuticals. So yes, if GSK comes back and they're producing paracetamol, they're not going to want Nigerian government to say we should fund paracetamol research. But hey, you can fund blood pressure medication. And so when you bring the likes of Pfizer for HIV medication, you can force them to fund your malaria, your sickle cell. That's how the game is being played. So let's copy and paste.
I'm here wondering if this was what happened to, I don't know if you remember Dr. Abalaka, who had the cure for AIDS at the time, and he, it was all over the place, and suddenly that died.
Even Professor Morris, the former INEC boss, said that he had cure for COVID-19 at that time. We didn't hear anything.
Why are we not embracing these people and trying to perhaps push this, even as a country ourselves?
Pharmaceutical, we're talking multi-billion, if not trillion industry. So the big boys don't want to step aside. But that's where you need government leverage.
Right.
You and I may have the intellectual property and everything. Once the competitor knows that you are there, they're ready to kill you. They have the financial, they have the network. But that's where we need government. And government has to be able to tell us that, look, healthcare is a major thing for me. If I'm not going to be successful on anything, healthcare. Because you know what? It spreads out, it helps a lot. Lifespan increases, quality of life increases, and the employment is there.
The president has said he is huge on investing into healthcare as it is. Now we have a vacuum that I believe that we can take advantage of as a country, especially by promoting these persons who have succeeded in carrying out researches that have, brought about certain cures to an extent. Can we push that at this time, and what can we do?
I think this is the right time. Yeah, we're talking government needs to come in, and government can come in multiple ways.
Right.
Help the private sector. We're talking, a few weeks ago, we were talking about the interest rate. Interest rate is killing. So the likes of people that have the intellectual property and their research is still in the infantry, if they have access to private funding, by the time the big boys know them, their medication is completed. So they need that capital. That capital can only come from the government. The government can cap it. Look, if you're coming in with specialized care or you're coming in with pharmaceutical research, we are making sure that your interest rate is not more than 4 or 5% for this period of time. It's investment.
One of the players in the pharmaceutical industry says that he said one of the ways the government can solve this problem is he's proposing the creation of Nigerian Bank of Health, just like we have Nigerian Bank of Industry. So this just like health financing, separating health financing from other sectors like telecoms, oil and gas, etc. Do you feel that's one of the ways to go?
I think that's a fantastic idea, because you see, all this engine we're talking about, it's money. Honestly, look at the electric car industry. U.S. government gave Elon Musk almost $1 billion on research after failures, and now they're enjoying it, and they're going to enjoy it for a long time. So that idea of Bank of Health, specifically for that industry, because that industry has been abandoned for so long. That is the industry that is affecting life, and it continues to affect life. So yes, that is a fantastic idea. They can even tie it to what our GDP is. If it's 0.5% of GDP, so you know that this thing is sustainable. Because we're going to continue to experience brain drain. We're going to continue to experience decrease in lifespan because all these industries are living. And guess what? Pharmaceutical industry is not something that creates mama put job. They create high-skilled, quality jobs that actually impact and change generations of life. So this is the time we actually throw out everything to get them back.
Now, if you're looking at investing into the health sector, we have never met the mark, the 15% of the budget, we have never met that mark. And I'm wondering what we can do if we're talking about investment, how much in terms, just to give it perhaps a figure, that we should perhaps be looking at injecting into that sector as we speak, and perhaps the low-hanging fruits that we should begin to look at addressing in the immediate.
So I'm an advocate that the government cannot do it alone. They need to bring the private sector into it. However, the government has the carrot and stick mentality. They can use it to attract the private sector. There is no country in the world where the government bears 100% of it. It's not going to work. But because there's so much opportunity, we're talking a country of about 200 million consumers. Right. And nobody wants to die, even where the healthcare system seems to be working. So that's kind of thing I'm thinking, that the government can bring stakeholders. You're talking about Healthcare Alliance of Nigeria. They know all the stakeholders, and then they talk with the government. We already have a good Minister of Health who is an administrator. Bring all the stake players to play, because now is the time. We're actually losing. Because to put a dollar figure on it, it's very different. Nigeria suffers mostly from non-communicable disease, the likes of high blood pressure, hypertension, diabetes, stroke. We're not talking about infection. Not that we don't have infection. I mean, the area of sickle cell is there. We're one of only 3 countries that still produce sickle cell patients. So there are so many low-hanging fruits that we can put money into. But before we talk about dollar amount, let's bring the people that actually have stakeholders in them. Healthcare Alliance is one of those.
One of the reasons why GSK, Sanofi, P&G, I want to say PNIG, P&G is actually leaving is because they also said that they're having to battle counterfeit drugs and all of that. So what do you think NAFTA can do? Because I don't know how they do this counterfeiting. You want to buy paracetamol, you see it just the same way it is with the original one, and then you just buy it. And you also say we even tend to pay more for adulterated drugs than
because of the
original one.
Yes.
So what has NAFDAC been doing? We saw that they busted some people in Aba, Lagos, etc. So what role have they been playing? And those who are consumers of these drugs, how can they verify the authenticity of these products?
Well, that is actually the 800-pound gorilla when you talk about the consumer side of it, because we need to be educated consumers. One of my nieces went to the pharmacy having an asthma attack. The pharmacist was bold enough to tell her that there are two options for the same medication, Ventolin. This one is 1,300. This one is 250. There is no way in God's hell that this one will be the same quality as this. It's obvious. 1,300 naira and 250 naira.
250 naira.
I thought you were talking about in terms of MG.
No. In terms of even the cost.
Okay.
Even the cost. Because you see, the cost is what drives most of our consumers because they're not as educated. And why? So when they go and you're telling them, I need medication, I need paracetamol, and they give you two. One is obviously better quality.
That's right.
The other one is cheaper. Because of the poverty situation and low economic situation, people tend to aggravate towards the cheaper one. But to your larger part of the question is, we need to strengthen NAFDAC. Trust me, every minute in the US, people are trying to bring in fake medications. But they know that once caught, their license is gone. Their families are affected. We don't have any enforcement here. You give licenses to people to open chemists, quote-unquote, pharmaceutical places, without having any clue in medicine. And you walk in there, they're the same people that want to treat you for malaria. They're just pharmacists. They're just chemists. They want to treat you for malaria. They're able to get away with that with impunity because they know no government official is coming to them.
To check the activities.
I've even seen some of them operating in a very dirty environment. Some sitting on a slot where you can't ordinarily go there as a human being, rational human being.
If you go to Lagos, Idumota, you see these people selling this medication in the open.
Some even hawk it
in vehicles and all of that, telling you how it works. And they know
honestly. And they have no clue.
The dosage you should take, and these people are not qualified. A lot has to be done with regards to that aspect. So I am also looking at the matter of having experienced hands. We are seeing them leave the country in droves. And you mentioned something earlier. They tend towards areas where they are appreciated. I need you to break that word down. What do you mean by appreciation? Because not just pharmacists, we have across the line, all of them just moving out of the country in droves. When we talk about appreciating these people, how do we do that?
So let's go back to the basics. So average length of year to study medicine or study pharmacy is about 5-6 years. So let's assume we have young ones at home planning to do that. You've invested all your hard-earned money to send them to this school. They've done their own job. They turn out to be good doctors, good pharmacists, and you throw them to LASUCOM. Where is the doctor that actually takes the blood? Is the doctor that transports the patient? Is the doctor that is going to be chasing after lab techs to get the results? That is lack of appreciation for that particular profession. I've been practicing in the US close to 30 years. Let me tell you, I never had to transport any of my patients. I'm not asking them to pay me more money, but they give me more room to do what I've been trained to do. I'm not a transporter.
Right.
Not only that, when it was time for me to go to medical school and this was expensive, the government stepped in and said, look, as long as you stay in medicine, you have 30 years to pay back this guaranteed loan. So I don't have to bother anybody for that. All I needed to do was focus on my biochemistry, anatomy, physiology, and all that. We are not doing that here. So yes, we complain about them moving. Any talent will leave. Nigeria is not unique to that. It's just that it's affecting us more because every sector you go in the Western country, there is a Nigerian doing well there. Why? The grass is not always greener on the other side. It's because they're watering that plant. We need to do the same thing here. We have the talents, but the only way to keep them is let's actually show a little bit of appreciation. You go to some of the resident quarters here, it's not ideal for people like you and I don't even want to talk about. And these are our future. These are the people we expect to actually go to work, all full of enthusiasm. No, they're not going to do that. And then talk about not paying them the right wage. So the easiest outlet for them would be any country that offers them something. And the more they do that, the vacuum continues to be created. And we're not going to be able to catch up.
Right before you came in, we just talked about the passing of former governor of Ondo State, Akeredolu, and then it's health-related matter. leukemia, as well as prostate cancer. He's not the first person to have died who left power. We know during the COVID-19, we saw the is it Chief of Staff to Buhari?
To the President.
To the President.
Yeah.
You know, he died in Lagos. And we also, former governor of Oyo State, Senator Abiola Jimobi, you know, all of that. When all of these things are happening, you know, you alluded to the fact that they always run to abroad, or to the abroad, so to speak, yes. to seek, alternative medical care and all of that. Is it the political will that we don't have, or is it that we are not sure that we have quality hands to handle some of these quality healthcare facilities?
I think it's a combination of both, and maybe extra. Because you have to look at it that, is it even patriotic for the governor of a state, let's not use the country, to just fly out abroad when you are the governor of UCH, of an environment that used to be one of the best in the world? There is something we need to question about that. It's either you're not sure, you are not confident of what your investments are, and what kind of example are you sending. So almost all our politicians, the next thing is once they get headache, they move out. But here is the kicker. What is killing Nigerians are things that if it happens to any one of us, heart attack, stroke, you need to be seen within 30, 45 minutes. So a lot of times when Nigerians go on this expensive medical tourism, 73% of them come back in body bags. So we don't have any positive data about why they're going. The more reason they need to look inward and try to strengthen these local clinics, these local hospitals. Because if we continue to do that, it's a false paradise. They will be traveling abroad. This late governor went out multiple times. Think about all that. That's disruption of family life. And it's not the only one, because you and I will probably do the same thing. And the reason for that is because we're not sure of what we have here. And yet we have the human resources, the best in the world.
But then for the common man in Nigeria, out-of-pocket treatment is something that is quite unbearable. It's not affordable for them, and so they embrace anything. When you talk about health insurance, the coverage is not up to how many % right now? It's quite appalling, really. How do we address this matter if we also want to deal with the matter of persons perhaps embracing quality care, trusting the system that is available for them, and also making healthcare readily available to everyone? So
your question is about cost. That's an issue that even developed countries are struggling with. Average cost of just childbirth in the US is approaching $15,000 US. Who steps in? Is the US government. They have the Medicare, they have the Medicaid. Medicaid meaning somebody is aiding you, and they aid you based on your income, based on your socioeconomic status. We need to have something like that. Nigeria is not ripe for one unifier paying system. Bring the government to come in, bring the private sector to come in. Healthcare is going to be expensive everywhere in the world, because it's capital intensive. Research, development, equipments are changing every two years or so. Yes, and the doctors, the training for all these medical professionals is exorbitant. So we need the government to step in. They've done it in other areas. We do our road construction with taxation on petrol. What are we doing about healthcare? Nobody's thinking about that. Bring the private sector. We talked about incentivizing them, either tax breaks and all. When you do that, you're going to start seeing the results. It's not an area where you see the result overnight, so let's fool ourselves. It's a long-term investment. The U.S. government did not go into the moon by thinking, no, Kennedy, years ago. So let's have a long-term plan, because it's high time. We're losing our young one. Quality lives lost to healthcare.
Even health insurance scheme, I feel all of these initiatives are designed to rip us off. Because sometimes you subscribe to a certain health insurance scheme, and then you feel like, okay, if I'm not doing my dentition, if I'm not working on my teeth, yes, then I should use the money for something else, even though the money that is budgeted for me is a bit large. So why is it that sometimes you go to the hospital and they say, okay, it covers this, but it doesn't cover this. But why don't you use the money for this, for that? So who checks that? Who works on that?
No, absolutely. We were experiencing something like that about 10, 12 years ago in the US. So they came up with a private insurance scheme where some of your money, you actually have the right to dictate what you're going to use it for.
Right.
You are not hypertensive, you're still young, you're healthy. So you know that what you need is vision and dental. So you can direct your...
And they tell you it's just 20,000 naira or 10,000 naira that covers it. And you can't expect money.
You can't expect that. No, when it's time for you to get the benefits, they tell you that it's not covered.
Yes.
And so that's why we need the consumer protection. The consumer protection will come in. We don't have that. So we're talking so many low-hanging fruits that can be effected, and we're not doing it.
So for 2024, as we look to wrapping up this conversation now, the direction government should take at addressing all of the myriads of issues that we have outlined, where should we begin, and what should the government do?
Carrot and sticks, try to do as much as we can to bring private sector in. We talked a few months ago about data collection. You'll be surprised Nigerians do not even know how many of our people have JAPA, how many of these industries, what are the effects of this adulterated medication. So bring the private sector in, try and do as much into health data collection. That will help you because data is the next gold. That's right.
That's right. I love the fact that you're always very big on data, and that's what we need.
Absolutely. For us to achieve any result, a meaningful result in the country with regards to health, we'll need data. Very, very important. We'll have to leave the conversation here now. Medical consultant, Chief Medical Director, Heritage Men's Clinic, Dr. Rashid Abasi. Thank you for your time on the program. Thank you.